lasers are in our future, and they're going to change your health in ways that you have never dreamed. And when we start thinking about the advanced detoxification that the nutrients like zeolite and high-dose vitamin C can do, and what those of us who can have access to a pulsed electromagnetic field device, you just will hardly believe what's going to happen. But to set the stage, I'm mentioning to you now that there's a university called Singularity. It's probably one of the most expensive universities because the heads of every department is usually a multimillionaire. And it was endowed by people like Ray Kurzweil to the tunes of millions of dollars because they really want to think their way out of the box. And I want to let you know that they have a Future of Medicine department, and we do know that the medicine being practiced today is yesterday's medicine. And when you see what's coming down the pike, and I can't cover it all today, but it starts with a simple application that you can hook to your iPhone that makes your iPhone into an electrocardiogram, and you can push a button and send your EKG to the doctor and avoid a useless trip to the emergency room because you just had indigestion. So it's good. The exciting new developments are going to mean that every one of us has the potential of living to 100 or more easily, because you're not going to be surprised suddenly by having cancer throughout your body, because tests are coming within a year or two that you will simply take a drop of your saliva or your urine and put it in an application that will go on your iPhone, and it will tell you instantly what's going on in your body. For example, look at the bottom slide here. We can tell you from your expired breath, when you blow out, we'll be able to tell you if you have lung cancer. We'll also tell you how fast you're aging. So please understand that although this sounds shocking to tell you that it's easy for every one of us to live to 100 plus, we also have a book called Abundance that says that even if we all live to 120, we will not overpopulate the earth because we have answers for the water, food, and energy and air problems that we face today. There are answers which we have. Now, just to give you an idea, there is a MR-guided ultrasound that is now absolutely stopped instantly on the spot. Parkinson's, a non-intentional tremor, taking care of fibroids so the patient gets up off the table and goes home. In other words, anything you think you know is wrong. You can't keep up. It's so exciting for me. I go to a meeting every week somewhere in the world. In 2 weeks, I will be lecturing for 7 hours in Sao Paulo, Brazil, to 1,000 doctors. And I come back with information that you can't get, but that's why we have FACT. If you belong to FACT, you'll know that whatever treatment you think is the state of the art, you are wrong. This is so exciting to tell you that what I will be discussing on the next webinar coming up on March 19 is going to be a really crazy topic. We're going to talk about bubbles. Bubbles in your tank. We're going to talk about how bubbles can deliver the needed nutrients to take an unhealthy cell and help it have the increased ATP that it can regenerate itself and communicate with other cells and do autophagy. Lots more to come today. Hold on, because all I can tell you is that we have such exciting information today to put together that every one of you, I assure you, it is not going to be just that every doctor has a laser in his practice, because you won't be able to practice soon without a laser. But we need to understand that how do we put all this together? Because on the one hand, it's hard for you to understand why I want you on 8,000 milligrams minimum of vitamin C a day. You'll say, gee, doc, my diet hardly ever gave me 8,000. Well, you're wrong. There was a time that your diet would have given you 8,000. That's 1 teaspoon twice a day of bioenergy C. And if you get bioenergy C, of course, proven by the studies done in the book Vitamin C and Cancer by Linus Pauling, anybody with cancer will live far longer if they're lucky enough to get enough vitamin C. It is not as good as if you put it in the vein, because if you put it in the vein, it's 100% absorbed. But bioenergy C is as close to that. So what I have to have you know is, how does light tie into all this? Well, when you're dealing with bioenergy C, you're dealing with electrons, and we now know that you are all electron deficient. And so that's kind of weird, a deficiency of electrons. Well, Dr. Sven Gorgi, the discoverer of vitamin C, Nobel Prize winner, told me over 35 years ago, it was like they used to say, go west, young man, or the future's in plastic. He said, Dr. Gordon, the future's in hydrogen. 35 years ago, I couldn't imagine what he was talking about. Today and next month, maybe you will understand what he's talking about. Meanwhile, my friend, Dr. John Ott, world famous, because he was the guy that came up with full spectrum lights that proved if you got rid of the other bad fluorescent lights, that the turnover of people quitting or not being able to keep up with the job was rapidly declined because people who had a healthy light and children in school stopped having learning disabilities when you gave full spectrum light. So light has been an interesting challenge, and I have the privilege of having known John Ott personally for some long period of time, and I need to add to that, if we are light deficient and we're magnetic deficient and we're nutrient deficient, wow, what would happen if we took care of all these things at the same time? How healthy would you feel? Well, at age 78, I'm feeling better and better each month because I keep learning more. And I'm hoping to share this more with you. Not everybody's going to spend as much as I'm willing to spend and take the time that I take to get as many supplements down and do my exercise and do these devices, but having been sick for so much of my life, all the way through medical school, unable to go up a flight of steps without going into heart failure, I don't resent the expense that I'm not an easy keeper. It takes a lot to keep me functioning, feeling as good as I do. But I want to make sure that we look at the spectrum on the bottom. On the bottom you have radio, microwaves, infrared, gamma, X-ray. So what we're going to talk about is right here in the where it says you are here. And so we're going to say that, can you feel the heat? Well, yes, depending on which part of the spectrum. So when we talk about lasers, and they happen to work very synergistically with magnets, it is astonishing to talk about electromagnetic energy is created at the atomic level. The electrons release energy because the laser kicks an electron to an outer orbit, and the more it pushes an electron to a further out orbit, the more energy is in that atom. Of course, you don't want to kick the electrons out of the orbit, then you have what we call ionizing, and that's what X-ray can do, and that's where you get damage. So we want to work with health. But what you need to know is that all objects emit infrared radiation. Infrared radiation, you're going to learn how we can help diabetes and hypertension and Parkinson's and Alzheimer's. You're going to be pretty surprised. Now, then you get down to the thing, well, is it just light or is it color? Well, it turns out color has healing qualities. And it was nice of Bob Rohn to say how stunned he was to find out that our bodies consist of tiny electromagnetic particles that vibrate. So that goes back to Michio Kaku, and Michio Kaku is the superstring theory physicist. In his book, The Future of Physics, which I quote all the time, because it was exciting reading and it only cost you $15. And he's the one that told you that because the cost of testing you is going to come down so rapidly that you'll walk into your bathroom and it'll make a diagnosis that you're running a fever, your weight's going up, your blood pressure's up. It was going to be astonishing that your PR interval is not. You're going to have the feedback that we need that rewards us when we don't abuse our bodies and we do our exercise and don't smoke and do get the sugar out of our diet. If we can get rapid feedback, a lot of us are going to live a long time, because it won't be, well, I don't think that I feel that sick when I had that third drink. Well, yeah, you do feel that sick. Your body will tell you. But as we put these things together, your cells emit and absorb photons, which are energy particles or waves of light. And so we're going to talk today about biophotons, because there is a role in your life to learn much more about this so that you can deal with a health problem that's been plaguing you. Because I don't want anybody to give up playing golf or dancing or giving up doing any of the things that we do that keep us active, because only by staying active do we have a chance of reaching our maximum intended useful lifespan, enjoying optimal health. So quantum biology, energy medicine, LED, light emitting diodes, so it doesn't always have to be a laser, or the low-level laser therapy, ultrasound, the PEMF, which I've taught extensively in the last few courses, are all part of what we're talking about now, quantum biology-based energy medicine. So let's look at, is there any valid data to back this up? Well, when you go and put in some of the keywords into Google, you're going to find that you don't have to put up with a non-healing wound, because you can have a non-healing wound after trauma, infection, cancer, instead of radiation. I mean, we have the pictures of the guy given radiation therapy who 3 years had the ugly open stuff on his cheek that in 2 weeks was half gone when we gave him PEMF treatment. So the picture is a little different when you're suffering from a weird disease. The doctor calls it Raynaud's disease, or he says you've got lupus or some big name. And then you think, oh, you're part of what? What percentage of America today are pre-diabetic? Well, if you have metabolic syndrome, you're pre-diabetic. If your fasting blood sugar is over 80, or your fasting insulin over 5, so we have at least half of us in this country today being pre-diabetic. So that sets the stage for things not healing. So what we want to come down to is the bottom here. It says, hydrotherapy, I like. Ultrasound, hyperbaric, I love it. I had 2 of the hyperbaric chambers. They were only $110,000 a piece. But I could take somebody who had had a stroke a week before, and in 1 day, using all of my tricks, they would walk out the door on their own power. They came in unable to use the right arm, right leg, and they walked out paying their bill and walking out on their own power. So I like electricity. I like these things and how to put them together. Now NASA has put some light on this healing thing. And light-emitting diodes, which, you know, are available everywhere, are being looked at for many possibilities. And you're going to learn today, on the bottom line, they react with cytochromes in our body, and that can lead to some very favorable benefits for us. So if we look at it, the next slide will show you that we are interested in having visible light-induced killing of bacteria or fungi. Erconia is a big company, which I have great respect for, doing a lot of great work with lasers. They're coming out with a laser in the blue spectrum, and it's designed for the treatment of toenail fungus. That's something that people spend a lot of money soaking their foot with potassium permanganate and turning their foot all brown, or taking a drug for a long period of time that can kill their liver. We're talking about waking up to the idea that following the blue 400 to 500 nanometer, which is going to have a better effect on killing certain fungi and bacteria than you would at the red. So there's reasons for us to acknowledge that no one laser can do everything. If you really go deeply into it, Erconia has a set of 3 different handles that charge about $25,600, because there's so many things you can do when you get into the violet and the red and the blue. But the thing is, we're down to some simple physics, photobiological principles of therapeutic applications of laser radiation. And this admits right here, Medline search, the bottom line says you search under laser and therapy, you get about 2,400 papers over the past 10 years. And you see that these papers are physical therapists, dentists to stop pain, dermatologists to treat eczema and non-healing stuff on your skin, including, in my personal experience, basal and squamous cell carcinomas. In other words, you give the energy and do some other good things, like, after all, zeolite pulls out the toxins out of cancer cells. That's why taking zeolite orally is widely used in Croatia for the treatment of both pancreatic and colon cancer, as well as all other cancers, because they've seen that these things, we can put these things together. But treatment of burns, diabetic foot, rheumatologists, chronic disease, chronic pain, arthritis, all of this, and then veterinary medicine. We had a great doctor of veterinary medicine attending the Erconia meeting that I was attending this weekend, and she's going to be doing miracles, as is my good friend Dr. Tim Patterson, who's a holistic vet in Payson that uses the PEMF and homeopathy, as well as manipulation to help animals recover. And so what are we talking about? Laser. What in the world does that stand for? Light amplification by stimulated emission of radiation. Well, what kind of lasers are out there? Well, the inexpensive one would be a little cheaper with LED, and then there's the LLLT, the low-level laser, and then there's infrared, and so anyhow, they can even combine it with vibration. And then there's all the different things in classification. Do you want a class 3A, 1 to 5, which is a lot less expensive, or do you think you need a lot more power? And that's class 3 and 4. So the point is this: class 3A is available really as being virtually harmless. You have to look directly into it for excessive time to even hope to cause a damage. The rest of the time it's doing nothing but benefit. But why, if we like it so much, why wouldn't everybody go to 500 or more? Well, it's called the Arndt-Schultz law, and we'll explain to you that it turns out that if you've been in the desert and you are really thirsty, and you come in finally, and you see it possible to have a drink, do you want to drink out of a fire hose, or would you like to drink out of a garden hose? Obviously, fire hose is overwhelming, and that's why you never need these 500 milliwatt treatments if you are working with the body, trying to aid the body in its normal ability to induce homeostasis and heal itself. So how is the laser working? Well, it increases cellular regeneration. So that means it's restoring cell metabolism. So I have recently given you all a lecture about a book by Thomas Seyfried. And Thomas Seyfried is a PhD at Boston University, world expert on brain cancer, and he points out that cancer is a metabolic disease. So now, if it's a metabolic disease and I can influence metabolism with a laser, maybe I can influence metabolism with my nutrients. Things are getting interesting here. And then you go to increasing cellular communication. So the phospholipid cell membrane, so of course I take a lot of supplements every day because my Beyond Chelation Improved has phosphatidylserine, and I like the glycocholine. I like lots of supplements that help the body. But let's look at what Erconia, as one American company, has done, located initially right here in Mesa. They've moved to Texas. And the bottom line is that Erconia, way back in 2002, got market clearance for chronic neck and shoulder pain. And they've been available for, is probably the least expensive was $6,000. The average was maybe $12,000, $14,000. And they do a great job of training, and they do research, and they have to deal with this country to be able to get approval. So we applaud what they are doing. And then look at skin. Acne vulgaris. Did you know that they actually, Erconia now has FDA approval to show that you can help break down the fat in an area of cellulite or a local area of fat that's really bothering the patient, and it raises the lipase enzyme activity of the fat cells so that the fat cell actually starts breaking itself down, and you can see actual reduction in the size of abdomen and thighs and everything. So this is pretty amazing. Something that's painless, that you don't have to have any surgery, that doesn't have risk. So then they got, as you can see, in 2010, they got approval for the reduction of waist, hips, and thighs. And they had already been proven that if you have breast surgery, you can have a lot of pain as well as dental. So it doesn't. So if you look at skin, orthopedic, wherever you look, there's exciting things happening. So if you get this book out of this Russian expert, Tina Carew, you don't need all the information in this book. It's probably pretty expensive to buy, but it's nice for you to know that there's so much understood. What is really going on? It's free energy from redox temperatures converted into electrical potential across the inner mitochondria. So you have all this mitochondrial dysfunction today that they're using as an explanation for many diseases in children in Parkinson. So you're talking about something here that's very central to many of the degenerative diseases that we are fighting today. In the middle of all the thing, you know, probably there's no question that if you deal with PEMF, you're raising ATP, and you're doing the same thing when you work with laser. So does anybody need the magnet? Well, bottom line, one doesn't entirely replace the other. Let's make a dramatic example. I've told you that if you move to Mars, there is no magnetic field and you will die. I do not wish to mislead you that you can get enough of the energy with the laser that you wouldn't have to arrange to do as we do with astronauts. Astronauts have to be hooked up to PEMF so they do not lose their bones and they don't die. But it is involved in some very exciting chemistry that involves cytochrome C oxidase. So that makes it very interesting because that was the COX-2 inhibitors that they first came out with when they came out with Vioxx. That was the anti-inflammatory that killed so many people. But it was working in this as a COX-2 inhibitor cytochrome. So it's interesting as you look at this. Energy medicine, the scientific basis. On the basis of quantum physics, the living matrix must produce coherent oscillations. Well, that's going back to what Michio Kaku with the superstring theory is telling you. You're nothing but a bunch of vibrating strings. And the predictions have been confirmed. And so vibration, including light. And so as you put all this together, there is, as I started to indicate, a need to learn something. Otherwise, doctors always tend to think, well, gee, if a 300 horsepower car is good, why don't I have a 500 horsepower car? Well, more power in this case of dealing with the body is not better. In fact, it can stop the benefits. Let me repeat. Arndt Schultz law says, and we have the documentation to prove this, that if you take and goose it up too high, you can sit there and treat that lesion and the skin doesn't go away, the skin lesion doesn't go away, the joint doesn't start to heal. So it's important to understand that it's nice to know that there's only these two things. There's the milliwatt power that we're going to give you, and we're talking about not huge numbers of power, 5, 10. We're not at 500. We don't even want to do it 500. And then there's the wavelength. Now, a lot of what we're going to talk about is going to be right here at the orange-red, where it's kind of hot. We're going to be at the 635. Well, it turns out that if you go way down to the 380, you actually have a bigger increase in the energy of a given atom that is being bombarded by the laser. So it's a little more energetic raising, but is that always good? Well, let's talk. If I go to the 700 and higher, I tend to get thermogenic. I'll start to get some heating. Now, heating is not the goal. In fact, the goal that we want is to be somewhere in the middle. But there's no perfect answer, because if there's a significant element of fungal infection, you're told you're going to be closer to the 380 than you are to the 700. But you're going to see today that if you're trying to deal with the exciting application I'm going to show you shortly, you'll be actually looking at the longer wavelength from 700 and up to 800, because you are interested in the ability to penetrate a little bit better, so that when you get up to 700 and 600, you penetrate deep, whereas the 3. So there's a lot of trade-offs, but you don't need to learn all this. What you need to know is there are, as I've told repeatedly in every one of my lectures, I say, look, there are glucose receptors, and your cancer cells are pigs, and they love sugar. So that's why if you want to live a long time, you got to stop the sugar trap. You got to get off it. But there's also photon receptors, and these are in the phospholipid cell membrane. In the phospholipid cell membrane is why I'm so gung-ho that I don't treat anybody with any serious chronic disease without telling them they're going to have to bring up the right oil. In other words, if you have a car that's going 100,000 miles, it's time to change the oil. And everybody who comes into your office that is sick, please change the oil. What do I mean? Well, if you did a simple ratio of omega-6 to omega-3, you could guarantee them that no matter how smart you are and how good you are with a PMF and how good, they can buy their own laser and take it home, and they're going to get benefit, but they're not going to get the maximum benefit unless they do the following. If you have more omega-6, which everybody does, then you need, what's ideal? Well, Samopoulos has written extensively about this recently, and she's one of the top authorities in the omega research field, and she likes you to be around, say, 4-to-1. You can have more. You don't need to go 1-to-1. But the omega-6s that we have, we've been inundated by corn and soy oil because they're so cheap. They put it in everything, and they drizzle it on your food because it doesn't cost much money. And the net result is we all have a relative omega-3 deficiency, which I can tell you that people like Dr. Joe Maroon, who's the head of neurosurgery at the University of Pittsburgh, and he's the Pittsburgh Steelers team surgeon, he's the one that when they refer you, because the guy's got so much pain in his shoulder going down his arm, nothing's working, they send him to Dr. Maroon thinking he's, as a neurosurgeon, going to operate, and guess what he does? He tells him to go home and take 10 grams of the really good omega-3 a day orally, and he says so many people don't need the surgery when they understand the simple thing. If I give you tons of omega-3 and you don't slow down and get rid of the cheap oils that are in our diet, and you've got to understand the good oil is what? You get good oil from coconut oil, and you get good oil from flax oil. You can even get it from grapeseed oil. There are good oils, but there's a lot of bad oils out there. And across the board, we have to stop the corn and the cheapened oils that are in our diet. Now, the big thing is this. When you play with this laser, the photon receptor is called an integrin, and they link, and what's amazing is this. To understand how this works outside in, inside out, the reason I'm making a big deal out of it is this. We've learned that I can take a good laser and treat a nursing home patient foot. And if I treat it daily for a month, for about 20 minutes, at the end of a week or two, that patient that has never spoken to the nursing home staff and seemed to not know who she was is talking and is no longer out of her head. So wait a minute, you telling me you treat the foot and you see a change in the, yeah, I do. Why? Because a single photon can trigger a reaction in one cell that causes the emission of several photons. So there are secondary effects. So let me try to make the point really big. The leading pain center, University of Washington, did a study on people with largely inoperable, resistant carpal tunnel. Nobody could help them. They couldn't keep their job. They couldn't work as a checkout. They couldn't type. They were in trouble, and nothing they did helped. What did they do? Well, they wound up getting all 35 of the subjects to be completely pain-free and back completely functioning. What? No. What did they do? They did laser. Where did they apply the laser? They didn't treat the wrist on anybody at all. The wrist is where all the pain was. What are they doing? Well, they did some studying in physiology, and they understood what's going on. So they treated the actual cell body, and the cell body of a nerve is not out there in your wrist. The cell body is way up there by the spinal column. So when they treated the cell bodies, which is near the neck, they were able to stop all that pain, and people were able to go back to work. So it's the living, so this cell-cell communication is a big story, and you're getting the wrong message when it keeps on sending the pain message. So how does acupuncture work? Well, it ties right into nitric oxide, and as you know, we did the No Sex Club to tell you that there isn't any sex without nitric oxide. So NO wasn't against sex, it was saying that there's no sex without nitric oxide. And now we can talk about how there's increased activity in meridians and acupoints, and the nitric oxide in the plasma goes up in the arm that's treated. Well, that's going to be no different than if you do the laser. So can one replace the other? Well, it would appear this possible. They would be synergistic. They're working slightly differently. So ultrasonic stimulation of the acupoints avoids the need of putting the needle in. So whether you use ultrasound or you use a cold laser, you're going to actually be seeing results. And so if we now, well, field is called ultrasonic active, so we can put things together. But the thing is to learn a little bit about where's the good area on the body to treat, so that rather than just treating the wrist that hurts or the fingers that are numb or whatever, we put in some knowledge of how the body runs. And so the word that you're learning today is photobiomodulation. Photobiomodulation is the modulation of laser irradiation with a color like red or blue, etc. And it certainly came out in the 1960s, and it's transformed phototherapy. The primary focus might be a key process so the rate of cellular molecules can be enhanced, and there's a dose zone. And so if you look at how it's working, Michael Hamblin at Harvard, just go to his name right here, www.photobiology. This paper goes on for about 40 pages with about 100 references. And when you read it, there's nothing more that I can tell you other than if you have your own laser, it's kind of like if I sell you a guitar, a violin, or a piano, it doesn't mean you know how to do very much with it. Now, doesn't mean you're going to get in much trouble with a piano or a violin or guitar, and you're not going to get in any trouble with the device that I'm recommending that every doctor is going to need, and more those of us who have been sick for a long time with inconvenient pain in a part of the body like the back or a joint or an elbow or a shoulder, or headaches. Our office staff at Longevity Plus has been dramatically impressed because they've come in sometimes they're just having a really bad headache because there's a lot of bad things in the air today. You're hearing nasty things about a big word called chemtrails. Well, it's not going to go away. There's lots of things contaminating our water, food, and air. But if I just have them use the laser on the forehead and then over the back of the head for less than a minute, both areas, 2 minutes, it absolutely is astonishing that pain is gone. So we've known that very low levels of photodynamic therapy can actually kill a cancer cell, destroy a blood vessel, or kill a microbe. So there's a lot to learn here. So it gets down to understanding something about transition metal coordination, which is why I'm so glad that we're coming into this from the field of my background in chelation therapy and zeolite therapy, because I'm used to dealing with the toxins and tying them up, because unless we do the whole picture, you're back to the same game. We have to recognize that cells have to be assisted in their job by having adequate nutrition, and with adequate nutrition you raise ATP enough, you will have a process of autophagy, and you're going to see shortly that that's been the subject 5 days ago of a New England Journal review article. You're going to really learn autophagy today and how all this comes together. So if we use a low-level laser, in heavens to Betsy, I mean, we can get an LED. I mean, you get one at Office Max when you do a laser pointer. You point it at the wall. And I've pointed out that I've helped people with a bad toothache by just opening their mouth and sticking that laser coming out of a laser pointer, which often is just an LED, onto the tooth to give it some of these photons. But then I also mentioned that if I happen to use at the same time a magnet, I get even more effectiveness, and it's all synergistic. Now that we understand what's going on, you'll be able to understand why the next program I'll be doing in a month will empower you in ways you didn't dream possible, because you already know that if somebody's really sick, that we have Tom Levy's excellent book as the primal healing power of vitamin C, that it is so powerful that you can heal many people, but it took a lot of it, and it took time, and we don't have time. We can't always get down 10, 20 grams, even though we have the best vitamin C in the world for high dose without getting stomach upset that really is absorbed by cell. You still need more, so we now are going to be talking about a markedly enhanced zeolite that will be providing electrons, so that everything I'm showing you on this slide is telling you that we can help wound healing. I mean, they presented a case of a lady that ankle was so badly injured that it swelled within twice the size within 5 minutes. And the best doctor said she needs a month, completely no weight bearing. She used the laser and other nutrients, and in 2 weeks is completely back at work with nothing. So but we know if she'd been lucky enough to have a PMF, she might have had that full recovery in 5 days instead of even 2 weeks. But we're trying to look at how can we put these things together. So we're telling you that at the top we're telling you if we have these energies somewhere between 600 and 900, and we treat an area that there's a receptor which is on every cell for that photon, and then the wound will heal, or the inflammation will go away, or the pain stops. It works for acute or chronic, and it works as an alternative to the acupuncture to the point you could just put the energy right over the acupoint, so you wouldn't have to know exactly where the point was. And you can help everything from Parkinson's disease to MS. So it's a big story here, big story. Now, the role of nitric oxide, that's why it fits so well, because we've started this series of talks with the No Sex Club, talking about nitric oxide and why it's so important and why we don't all have a Viagra deficiency, but we, for legitimate reasons, have bodies that are not efficiently making nitric oxide as well as they could because we don't have the needed nutrients and we don't have all the toxins out. You can never get all the toxins out. You need to get that clear. That's why I try to have people understand that 100 IV chelation doesn't mean that you have no more lead in your bone. It means that you're feeling good because I have as much as lead as I can get out of the kidney, the heart, and the soft tissue, and the eye, and vision is better, but I can't get it out of bone without you staying on some detox with EDTA and zeolite for the next 15 years because bones remodel. When they remodel, they are dumping toxin, lead in your body. So let's look at this slide. It's telling you that if we are using low-level lead to promote healing, it is absorbed by cytochrome C oxidase, and that nitric oxide is produced. So look at this. That is the magic molecule of the year a few years ago, and every drug company wants to make it for you. In here, you can produce it in your mitochondria because you inhibit and bind to cytochrome C oxidase and competitively displace oxygen. So this is pretty exciting stuff. And if we get the whole story, you're going to have the proton pumping, the sodium potassium pump. No wonder the pain goes away. You'll increase the oxygen consumption. In other words, we're talking about energy charged, almost like, but not synonymous with PMF. But that's why it becomes nice, because this way, if we have a PEMF doctor in a community, people might see him once a week and get the big treatment, and they might own their own laser, and we'll get in some choices there so they can support. So what does this red or near-infrared light? It is increasing cellular respiration. And so what you're trying to do is you're trying to increase the ATP, and that's what you do. Normal cells don't see a big change, but you release nitric oxide, and it increases the blood flow to the sick areas. So that's wonderful if you've got cancer. And I would argue that if you can't afford a PMF, that if you have a tumor in your body, you want to be using a laser. And as I've said, you don't have to use, if the lesion is in the breast, it might be that you'll get some of the best protocols they have. About half of the treatment time is put over the area that's where the tissue is hurting or is not healed, and half of it will be over the spinal column where the cell bodies are for the cells, the nerve that is involved in the pathology that you're fighting. So now you get another big story. We know that when we're working with photobiomodulation and nitric oxide, and even an LED, what you're getting is an enzyme that will reduce oxygen to water and has been shown to have the reduction of nitrite to nitric oxide. Now that's the goal, folks, because we have such a toxic planet. None of us have as much nitric oxide, which you remember kind of went back 50 years ago when I got out of medical school 54 years ago. What you did is you put nitroglycerin under the patient's tongue and their chest pain went away. So we're telling you now that I can do the same thing without getting the headache that the nitric oxide, the nitroglycerin gave. But low-intensity light enhances nitric oxide synthesis. Now that's kind of right down our alley, and we've identified a deficiency of nitric oxide is the problem. So here we're talking about erectile dysfunction. Instead of having to just use Viagra, we're saying in vitro studies so that the laser light will induce vasorelaxation that produces penile erection. But again, you don't have to treat just the organ itself. You can be treating the spinal column where the organ is innervated. So as we look then at this picture, mitochondrial signal transition and retinal healing. So photobiomodulation by lead is going to show that we can show that it increases the production of cytochrome oxidase, and you're going to soon see that it's going to be treating so many conditions that we are all fighting, like how can we save our vision? Everybody's worried about macular degeneration. Well, I've announced that Dr. Conrad has been doing great work using a microcurrent and homeopathy and detoxification. Now he's at the PEMF. Nobody will have to go blind with glaucoma or macular degeneration. So all of these things, even if it's a traumatic injury, we're going to see benefit with what we do here. So the mitochondrial mechanisms of photobiomodulation all ties to ATP, and you've already learned from me repeatedly that ATP goes up dramatically with anything I treat with the magnet. So if I have a patient come in twice a week and treat the really bad knee that they think is going to have to be surgically removed and replaced, that's dumb. Don't get a new knee. Take care of the one you've got, because if you're going to live to 100, no knee they give you is going to last you more than 8, 9, 10 years, and you're going to be sorry because many of them don't last that long. So we need to look at this chart. How many things can laser do? I can answer it easier. What can it do? It's going to reduce pain, stop inflammation, heal wound, and rejuvenate skin, and reduce and lead to wrinkle reduction. So we've told you all about the B-Cure. And the B-Cure is still available at the introductory price, and it has to, I repeat, the actual shipment has to come from the approved dispensing distributorship in London, and then you buy it, and it takes a week or so for it to be arrived in your hands, because it's not FDA approved in this country. There are many, many FDA approved ones, and I'm welcome to have you buy any. It's just that when I saw something that was so affordable, that is well below the $1,500 price range, it can change so many lives. I really felt motivated to help bring this, because you have dental benefits. Look at what you spend on the mouth. Just look at how, if one family owns this and the kid doesn't have to go to the dentist for a tooth to be treated, and the ear pain goes away, and you've sprained the ankle, and the kid can then go back to the game, and the dad can go back to playing tennis. I mean, it's kind of to the point where our health care is so expensive. It's self-defense to have something. So this is the newspaper writing up how many things it can do in as little as 6 to 8 minutes, and how many reduction in all the stupid drugs we buy. Our goal is to get you off the drugs, and I can do that if I start with a simple thing I said earlier. You got to take a lot of omega-3 and stop the cheap oil so I get less omega-6. I do use one omega-6. It's in the Beyond Chelation Improved. When you take your 9 pills, you get a very expensive primrose capsule so that you are getting the omega-6 that is important, not the junk oils you get from corn oil that makes it hard for your body to turn out inflammation. And we've shown you these slides that you can make things heal much more rapidly with the laser, and you can get the elbow well and the back. And you have this lady who was absolutely for years unable to go back to her gymnastics, and she patiently just treated herself day after day after day. And so you don't cure something by treating it for 20 hours nonstop. You can only raise the potential of the cell, and if you really had to maximize it, we believe at this time that 20 minutes most, max, 4 times a day is better than 80 minutes once a day, or is better than 10 hours once a day. It tends to be kind of that way with the magnet too. In general, I have said that I treat myself sometimes with an hour, but I see the magnet, I'm trying to treat different areas because I have a knee that I want younger and a kidney that I need to improve and an eye and skin of the face and a heart, and so I've got lots of things that I want to treat in my body. So it's not that I treat one area constantly because the body only gasses up the cell and then the cell does its work for a while. Then you can go back later and gas it up with this laser or the magnet. So the gymnast use substantially decreased without the use of painkillers. See, the painkillers alone are going to make it impossible for your body to heal. So we really have to understand that we need to set the stage because we like to have people well and off of all drugs. Now, the pain in the arm that had lasted several years was reduced 80 to 90%. And the teeth and the gum aches appeared after 2 treatments. It's gone. So that's kind of worth something. So let's look and change the pace. What if we take this little device on the left, and you see how small it is, and it actually could be inserted in a person's nose, and then look what's happening. Intranasal light therapy simulates restoration of homeostasis in the body. The V-light is a certain specification that was designed to be treated either left or right nostril for 25 minutes in a day. And it stimulates the midbrain area to the hypothalamus and the pituitary. So you're going to see increases in growth hormone level. So this is light being put because our bodies really, we do photoluminesce. In other words, every cell gives off light. If you have the right equipment, a photoluminescence detector, every cell in your body is putting out light, but it only does that when it's healthy. So we need to know that the face can be made younger, and we can have a lot of benefits with this. So let's look at it a little deeper. History of light therapy would show you that initially they found that it would cause hair to grow on a mouse, and now it's being used. There's a laser cap that you can buy that just treats your head. But then we got wanting to treat more serious conditions, so in Russia we did a lot of work. You can see how in the middle picture we have the actual laser has been inserted into your vein, so it's treating all the blood. And we said, wow, that's inconvenient. You have to find a doctor and stick something in your arm, and that hurts. So why couldn't we do another thing? Well, why in the world would you stick something in the nose? Well, guess what? There's about 3,000 studies saying that it does something to the immune system, circulation, does something to the brain, treats the depression and the Alzheimer's. So, oh, wait a minute, one thing is doing all that? Well, let's look at it. Look at this picture. These are the blood vessels that are in the human head, and look at where it all is. It's in the back of the nose. So without having to bother to stick the tube into your vein in order to treat your blood, I can treat your blood beautifully. And watch this. Guess what's right behind when I put it in your nose? Look at what's right behind us. You know, here's your nose, and I'm putting that light in there. And that light is going directly toward the brain, the hypothalamus. The pituitary is right there, folks. That's the master gland of the body. And the pituitary, in everybody that we do an autopsy on, is loaded with mercury, just like your hair is loaded with mercury. That's one of the reasons you're aging. That's one of the reasons I'm on daily oral chelation and oral zeolite in my power drink, is I understand that what certain tissues like your thyroid, it's so loaded with toxins that at age 50, if we take the thyroid out of a dead person, we can find some cancer cells in almost every thyroid we take out. So that's why I have most of my patients taking not just iodine, I have them taking thyroid. The point is that you've got to feel good. We have to have, I take DHEA and I take my Beyond Growth Hormone support so that I can make new muscle. And we've traditionally done that to a child. The child hadn't been growing at all. And suddenly the child started growing with a safe, natural, nutritional product that's based on mumio and tribulus and hypothalamic factors. The Longevity Plus cells called Beyond Growth Hormone support. After all, I'm 78 and I don't want to be weak when I'm 90. I don't want to be unable to open the door. So I take all these things, but try to look at this picture. This picture explains to you, olfactory means like breathing, okay? So why am I making a big deal? Well, the older you are, the less effective you can discriminate bad odors. So you could actually eat some spoiled food because you didn't know, because you weren't getting. So we've been able to prove that we tie how fast you age to how unhealthy your ability to discriminate smell is. And we've been able to prove what I'm going to show you. We can regenerate that ability with what we're showing you today. So we're talking now about using Dr. Daniel Amen, specialized in the SPECT scan, and we have the ability to show before and after. In every case, there's a marked increase in the warm areas when you use this simple treatment that we're showing you. So what we want you to understand is that the intranasal is putting it in the nose, and it's winding up treating your brain. So what is the power now? Well, we're going to use a wavelength of 810. Now that's different than the one from Israel, which is 635. So there's one of these isn't. So I don't want to confuse you. If you've already bought the Israeli laser, all the more power to you. And I am completely happy with those people who are lucky enough to own the Israeli one. Go ahead and apply it over your nose. It's going to do a lot of this magic because the nose is so vascular, because I showed you the picture of how much blood flow is there. But I'm letting you know that we've been working with Harvard on perfecting the device that I'm introducing you to now. And so we have found that the ideal penetration to get the best effects on Parkinson and Alzheimer's, etc., is at the wavelength of 810. So even though both of them are in the safe ranges, one 635, other 810, and this has got a power density of 10, the other one power density of 5, you just need to understand that that's not the game that wins. The game that wins is the one that has the best science behind it. And so we have pictures of brain cells that are being healed by this process. This is a brain cell much. Look at this. Here it's got all the terminal twigs. This cell came back to life. And natural treatment for insomnia and slight sleep. The red light appears to have the opposite effect of the blue light. And so that they've repeated 50 patients using the device that I'm recommending here for 60 minutes once a day. They improved significantly in 82% of the cases. And so what improves? Well, this is what I'm talking about. I'm talking about the nose treatment. This little device here with a little tiny thing, you stick it in the nose, you do it for 25 minutes, and what can happen? You increase ATP, serotonin increases, increase endorphins, increase anti-inflammatory, improve blood circulation of the skin in diabetes, decrease permeability of the nerve cells, causing hyperpolarization. Anyhow, across the board, it's going to help hypertension, hyperlipidemia. This is a lot of stuff, and it's only LIGHTful. In other words, in Canada, this is actually only sold as improving quality of life. Quality of life, the same as if you improve the quality of the water you drink, or you get something to improve the air in your room, or you get something to improve the sound level, the quality of life. And so this is light. It is not being sold in Canada, as they know what it would cost to bring it out for Alzheimer's, for heavens to Betsy, to prove it for sugar diabetes. But what they can say is it improves health care, improves natural immunity. And so across the picture, nitric oxide in the paranasal sinuses. Well, how many people do we have with chronic sinusitis in this country? Well, now it turns out that if you help with this trick that I'm teaching you about, your nose actually generates nitric oxide. And when you inhale and it goes through your nose, you're treating your whole body with more nitric oxide. So you can now begin to understand why this simple little thing of putting something in your nose is going to help you not just with your chronic sinusitis, but your COPD. In other words, every part of your body, you enhance blood flow and increase nitric oxide. And so now we're increasing it by simply treating the mucosa lining your nose. And you lower high blood pressure naturally. Of course you're going to lower it, because it just does. You remember when you take Beyond-Chelation Improved, the 9 pills twice a day, remember there has not been a fatal heart attack in anybody taking those 9 pills twice a day in over 20 years, even if they've been told they have a high-grade obstruction, they need surgery. Surgery is nonsense. Nonsense. I repeat, if you're my patient, I do not let people have bypass, and I don't use stents because I know what I'm doing. I get your records and I explain to you why they're full of hot air, because the angiogram they use does not tell you the truth. A PET scan does. Anyhow, but learn this. I've been trying to teach everybody that we lower blood viscosity, so that we do that with my Beyond Chelation. But my Beyond Chelation is expensive. It's going to cost you, what, $130 a month to take 2 packages a day and stay alive. Of course, that's pretty cheap for some people because otherwise they'd be dead. I have many people who stay alive just because they take 2 packages a day, because they lower blood viscosity. And I put it this way, there's never been a report of anybody having a fatal heart attack or fatal stroke on the 2 packages of BCI. But what if they were smart enough to have this little nose treatment? Would they get away with 1 package a day? I can't swear that they could, but I can tell you I'm in the right direction, because you see it's all going the same direction. I'm helping you just by getting weight off and stopping smoking, making you walk around the block and getting rid of too much sodium and stopping the amount of alcohol. I'm helping you by doing one simple thing. I'm raising the overall health of your body, but light, just putting a light in an area of the body that needed a little more energy. And this is the before and after. The blood doesn't sludge anymore. And of course, this is a person with a really painful hand. Their hand was actually suffering from Raynaud's disease. And, you know, those fingers are painful, and they can't work. They're going to lose their job. So is this possible that an impossible disease can be helped by as simple as just doing this? And look at this. This is an AIDS patient. And here, look at CD4 was 400, now it's 600. That's the difference between life and death. Here's another AIDS patient. Again, they were about 450, and they go way up over 650 because they're lucky enough to get this. So is there any clinical evidence that light in the nose is helping these things? And yes. The company wants to keep it affordable. They do not wish to make it a drug. Once they make this a medical device, so what this is going to be, I mean, this you could consider your reading light. But what's reading is your brain is reading its need for photons. So it's Parkinson's, Alzheimer's, all these things we have evidence, dementia, migraine, lung disease, sinusitis. Of course, why? Because photons in quantum mechanics are electrons. And the next time I'm giving you a talk, I'm going to make you so knowledgeable about electrons and how I can give you some hydrogen that's going to be life-changing. This is to let you know that New Biomed is the name of the company that I am working with Jim McBride, and we're bringing in from Germany this low-cost PEMF magnetic field for home use, because I liked the Beamer, which is a good device from Switzerland, and there are other ones. This is the newest one. I think that it's turning out a lot of power for the price range, and we'll let in more about that at another time. But I want to make sure you all understand PEMF increases the membrane permeability. And now, 5 days ago, New England Journal has a review article on my favorite subject, autophagy. And I've told you all I said mice, magnetically induced cell exercise induces autophagy. This is going to explain to you how, if you follow my programs, you are going to be able to effectively treat everything from diabetes to muscular dystrophy to Alzheimer's to cancer. Anybody having Alzheimer's or cancer not getting the benefit of autophagy. What in the world is autophagy? Well, you're going to get more about on the next lecture. What's electroporation? That's how I make the cell membrane open for a second so more nutrients can come in. The physical method by which this goes is terribly important, because the lipid molecules are actually allowing the magnesium and the vitamin C to get into the cell, and then the cell energy goes up high enough that it can push the toxins out. So this is how the pores open momentarily when you do PMF, and with the pulsed. Remember, the device I'm describing now for the nose, studying it at Harvard, we found it had to pulse in addition to the right wavelength in order to get the maximum effect. So now I'm teaching you electroporation and how we can change how your cells take up nutrients and have the energy to now take up. The initial photodynamic is more effective than drugs. And so electroporation is actually going to allow us to take dogs and they don't have to die of renal failure. Put it this way. If you became an expert on EDTA, because I've only read 7,000 papers on EDTA, you would know that New England Journal of Medicine published the paper that EDTA would have stopped anybody from ever really needing to be on dialysis. And so many dogs wind up on well, they go into kidney failure because dogs die of cancer, unless you happen to remember that Longevity Plus sells zeolite for you to bathe in, zeolite for you to swallow, and a new improved zeolite that we'll tell you about in a month, and a zeolite that you can give to your pets. and the baby the 1 hour after it's born. Because remember, the baby is loaded with all the toxins the mother had because nobody gave the mother any of the zeolite during the pregnancy. So the photodynamic effect on cancer cells, we're going to have the chance to go into this more next week, but you need to understand that PEMF enhances photodynamic activity by more than 40%. So what we're saying to you here is this. For the lucky people who can combine things, and I will be doing a whole special on the topic of the MTS7, in which in one system you have got LEDs and lasers and heat and magnets, and so in one system, as well as color. So remember, I'm the guy that has been teaching you about this simple cell. The cell has got a mouse, he's got a broom, he's going to get in and he's going to sweep the junk out of it. What's the junk that's in your cells? In your cells right now, you have dead and dying mitochondria, dead and dying lysosome, peroxisome that need to be thrown out of the cell so the cell can do its job. You're getting cluttered like a house that's never been had any spring cleaning. So that's our job, is to teach you how we can put all this together with the magnet and have a little change thing, and the electrons can act as antioxidant, and we're going to be teaching you about the enhanced zeolite that will be introduced in our March 19 webinar, so that you will be able to see some of the amazing things that happen, not just from the electrons from the Earth, which the earthing idea was a good idea, but we have to go way beyond that, because too much of the Earth is already in an urban area and there is no friendly electrons. It's being already used by the power company to return power. So PEMF exercise will make your energy. So if you understand, I'm going to teach you next month about how zeolite enhanced. It's got more hydrogen than anything we've ever had. And now I'm going to take, if you do that with any PEMF, you're going to be able to really dramatically change how rapidly things are breaking down. And the new zeolite story is terribly impressive. You won't have a chance to read it today, but this is the latest research this month on zeolite. This is the zeogold that we want you to know that I take one twice every day. I open the capsule, but in a month we're going to have one that's just as a scoop. You won't have to open any capsule. The zeogold enhanced is going to be working along with a micro bubble of hydrogen, which is the most needed nutrient to maintain the electrical balance in your cells. And so this is now going to be not just a chelator, it's a cation exchange activator. The pH shifts to being slightly alkaline, very important, and you'll see micro bubbles are being produced. So that changes the oxidation reduction potential. And here's a very exciting thing about the microparticles filled with oxygen that are already saving lives. So this is all so this is a healthy red blood cell, teaching you about how to get that red cell feeling fully charged with oxygen. You all know that I teach people that if you are having enough vitamin C to keep the simple stick in the yellow color, then you are going to have a bright future, because that stick, if it stays green, there's not enough electrons for you to neutralize any of the bad guys that are in the area you're breathing. And of course, I have everybody on my power drink with maca. BCI is the 9 pills that has stopped all fatal heart attacks in patients of mine, and we teach everyone that IV chelation is fantastic. I love it, never stop giving it, but it doesn't solve the problem because it doesn't get the lead out of the bone. So you still have to be on an oral program for life, but IV makes things faster. But for those who can't do that, look at what I can do with PEMF and laser, and bathing and laser at home, and bathing and EDT at home. I do consultations to help you understand how to apply all these things. Doctors get the consultation at half price, instead of $300 a month. 300 consultation is $150. If you don't belong to FACT, you need to join, because knowledge is doubling so fast. And I'm going directly tomorrow to Long Beach, where I'm doing a workshop on Thursday afternoon, and then we're presenting at the conference at the Hilton Hotel in Long Beach. I hope to see some of you there. And stay tuned. March 19th, 3 o'clock, we're going to be teaching you about tiny bubbles, hydrogen, and energy. You will not want to miss it. Thank you for your attention today.
Dr. Gordon, we do have a few questions in here. Are you able to accept a question today?
Yes, I'd love to.
Okay, this one is from Linda, And our question is, once you start laser therapy, do you need to continue for the rest of your life?
No, laser is absolutely. Just go on Google and put in the word laser plus what you're interested in. If you have 10 in it, I mean, if all you're trying to do is get rid of a problem, the reason that I want people to own a laser is because if you go back and forth to a doctor's going to have to charge you $30, $40, $50 to use his laser, and he should. He's got to, because the lasers that I'm giving you are jack-of-all-trade laser, and when he buys specialized lasers and he pays $25,000 to have access to them, he's going to have to charge you. But the thing is this, why does he need a $25,000? Because time is money for him and you. You only have 10, 20 minutes to be in his office, and he's got to see another patient. Now, if you own your own laser at home, you can do 15, 20 minutes morning, and then at the end of the day again. So the laser empowers people to become able to deal with injuries, happen to loved ones, but anybody that doesn't think that they're going to need it, if you're a young person and you just had an ankle that is going to take you out of the game and it's going to cost you your career, and you buy it and you get your ankle back, then by all means feel free to sell it used. Get most of your money back. People are going to be learning about lasers, and they're not going to get any cheaper. So that's not a problem.
Okay, the next question is from Robert, and his question is, if we are told every tissue is wavelength specific, how can a laser treat so many conditions with only one wavelength?
It's a great question, and I give total, so go to Erconia and study their stuff. I want to make it very clear. I've said today, there are advantages. They do sell you a violet one. They have different wavelengths, and they're going to have one that's going to be almost blue. There are different wavelengths, and they will have definitely increased a facility to help a particular problem. But in the middle of the range, in the middle of the road, you have a simple problem. You are living on a polluted planet, and you are a polluted person, and you are loaded with bisphenol A, and it has knocked out your methylation effect, and so you do not have optimal levels of nitric oxide. And nitric oxide is the messenger for every human being. So I win in any case. However, if you're a millionaire and money is of no object, by all means, please see some of our we have great doctors who have really studied with Erconia in the different wavelengths, and then we have beyond the wavelengths, we get into frequencies. So the more specific we go, yes, the faster, but let's stick with the simple thing. The simple thing is that everybody is operating with suboptimal levels of nitric oxide. That's proven by the research I have done. I am the expert on chronic low-level lead, and chronic low-level lead was written up this week in Scientific American. I'll try to bring it to you next week, because they said stop looking for the few people who have acute lead poisoning, and let's treat everybody on the planet who's got chronic lead overload. So when you see where I'm going, I'm taking every person within the sound of my voice, and I'm making them operate more efficiently. That doesn't mean that is optimal. If you are some top athlete earning $1 million a week, yes, let's play more things. But most of us are happy just to get rid of that back pain, get that knee back to functioning, be rid of our headache, stop having the chronic sinusitis, and have our blood pressure back so I don't have to take drugs. We are just a middle of the road. There are clearly advantages, and I will advise anybody that's taking it seriously, take an Erconia course. They put them on for 2 days. They do them web by ERCHONIA. They are doing a great job. Next question.
The last question we have today is from Joanne. Will the intranasal low-intensity light therapy help for sleep disorder in Parkinson's?
Absolutely. Those are two of the very solid things. So please, the talk I just gave, the slides will be back up within 2 days. Please go and take your time and read the slides, because I went over it and glossed it very, very rapidly. But this is the tip of the iceberg. I have another 100 slides I wanted to show you today, but we've given you a pretty good smattering. The answer is yes, yes, and yes. In other words, the gentleman that is behind this has worked 10 years to perfect it to the level, and he's obviously compulsive, because most of the laser companies, except with the exception of Erconia. Erconia spends money, does real research, really gets FDA approval, and the one that in Israel really has the most approvals of any company in Europe. So I deal with people who spend money. And so bottom line, when you spend money, you have studies, and he is working with Harvard, and he kept working, and they changed the wavelength, and they changed the pulsing to be exactly what it is for the nasal. The nasal one, as I repeat, is 810. That 810 is not going to be the best thing for your carpal tunnel and for your ankle. You might get some benefits, but it was really designed to treat your whole body by putting light into an area we had never thought we needed light in. And that's next to your sphenopalatine, your hypothalamus, the hypothalamic center, the center of our whole body. Where I mean, the results are beyond. When I first thought it was nonsense. You mean putting something in the nose and the blood pressure gets normal? This is crazy. You mean the diabetes goes away if they release growth hormone? This is crazy. But it's not crazy. There's about roughly, they believe, over 1 million of these, not to this level of sophistication, already sold in China. And the company that built this one knows their market is so huge that they built the one that we are introducing so that in case you happen to not see it and you drive over it with your car, it would still work. So he wanted it, he's pretty dedicated to the machine that we're recommending you spend, and the price of that is $499.